So the first thing we need to do is to get you to wear this headband. Essentially, it's going to sit nice and snugly around your head. What I might ask you to do first of all is actually to take your headband out, so that then we can get this positioned securely over your back of your head. Perfect. Right. And actually, it might be easier if you take your glasses off and just hold on to those a second. So first things first, I'm going to pop this over your forehead. I'm going to slide it back over the head. So it's going to be quite tight. I'm going to feel at the back of your head, just to feel the center point. I'm just going to move this into position. A bit of maneuvering while I get everything central. And then if you could turn away from me a bit, there we are. Just want to make sure this is all lying centrally. So I'm just going to make it a little bit tighter, if that's okay, because it needs to be quite secure. So let me know if it's uncomfortable, but we all need to be quite snug. All right, that's not too tight, is it? Yep, perfect. Right, so the next thing I need to do is to start cleaning the area underneath where the electrodes are going to sit. What I'm going to do is I'm just going to move the hair out of the way, clean the scalp with a small cotton bud, and then I'm going to move the hair back out of the way again, okay? So it's underneath here. I'm going to move the hair out of the way just so the electrode can sit on the skin rather than on the hair. And then you'll feel a bit of a scratchy sensation as I clean the top layer of the scalp. And then I'll position this back over the skin. Perfect. So that's one of them done. Just going to do a few more. Finally, we'll just do a clean of the forehead under the strap here. Clip an electrode as well, just onto the outside of the ear here. That should sit there. And again, each of these electrodes, I'm just going to put this jelly-like gel that just improves the connection between the electrode and the skin. So I'm going to put one at the front here. If you turn to face the screen again, so a bit more of this gel is just going to go in the back here and sit on the skin. It just improves the connection between the recording electrodes and the skin. The next thing I need to do is to connect you up. So this is actually going to sit over your neck like a necklace. Yeah, what we'll do is attach each of the electrodes. One goes there. This frontal one. Now just hook that behind your ear just so it's out of the way. The final thing I need to do is to ask you to wear an eye patch. What I've got here is a makeup wipe with some sellotape. So perhaps I'll pop this over your left eye and then we'll record from your right eye first. So if I pop that over like that, you pop your glasses on now and we'll make sure that everything perfect. Okay, so now I'll be able to record just from the right eye. Now I'm going to get you to turn towards the screen. I'm going to position you so you're in the center like that. And what I want you to do is to be just adjacent to this arm here, but not resting on it, okay? So I'm recording from the electrode underneath there. Good, okay, I'm just going to reposition the screen. Another thing we often do is we measure the size of your, we'll measure the size of the head. So if you lean back a second for me. So if I measure from your nose here, so 31 centimeters, that means that when I'm doing the test again, I know I'm putting the electrodes in exactly the same place. So what you're going to see is a chessboard type pattern, and there'll be a red cross in the middle of the screen, and your task is to keep the red cross in focus. Now, an awful lot of what you need to do is actually to stay relaxed, which is quite tricky to think I'm going to relax. But the things to think of are keeping the tension out of your shoulders. I ask people to have both eyes open so that you're not scrunching up the eye that we're not testing. And actually, it was also helpful is just to keep the mouth very slightly open, because that takes the tension out of your shoulders, your jaw, and the front of your face. Because these electrodes are so sensitive, we don't want to pick up the electrical signal from the muscles. So keeping relaxed just allows us to get a better recording. Perfect. So I'm going to start off the test. So if you just keep the center in focus, you can blink when you need, but try and keep the blinks to the minimum if you can. So while the screen's flashing, keeping everything relaxed, keep that cross in focus. And this lasts about 15 or 20 seconds or so. So keep going, keep it in focus. A few more seconds. Well done. Okay. So now have a rest, have a few blinks. When you're ready, we'll start you off again. Okay. I'll start off again. So same thing again. Keeping the red cross in focus for 5 more seconds. Well done. And we'll change the patch area. The glasses back on. So keeping your gaze fixed on the center of the screen, both eyes open. So this is what we look at when we're analyzing someone's visual evoked potentials. So this is the recordings taken from the left eye. And what you're seeing here is the averaged electrical signal recorded from the electrodes at the back of the head in response to that flashing stimulus. And as I mentioned before, you get this wave shape. And what's quite reproducible each time you do the test is this peak here. So what we have here on the x-axis here is the time. So 100 here denotes 100 milliseconds, 200 here, 200 milliseconds. And what happens normally is this peak forms at about 100 milliseconds. So we can say in this case it's slightly shifted to the right, i.e. it takes a bit longer to reach the brain, but it's marginal. And actually when someone's had an episode of optic neuritis, when someone's got MS-related damage or demyelination of the visual pathway, what tends to happen is this curve gets shifted to the right, which shows that the nerves are conducting more slowly, so it takes longer for that signal to reach the brain.